Today I'll be looking at the effect of transcranial direct current stimulation on major depressive disorder. Transcranial direct current stimulation is thought to be able to combat the negative side effects of antidepressants. In particular, the reliance patients can develop to antidepressants is problematic, as patients may become addicted, leading to further issues. Therefore, it is also seen as a lifelong solution for some patients. But what is TDCS? Transcranial direct current stimulation, or TDCS, refers to neurostimulation delivered by electrodes, an anode and a cathode, which produce a constant, direct current. There are four essential pieces of equipment for the procedure of TDCS, as shown on the slide here. Research has shown that the placement of electrodes is crucial in TDCS in order to produce an accurate result and therefore requires a localization method. Localization methods are used to help navigate sections of the brain. For this purpose, the International 1020 system, based on an EEG exam, or a neuronavigation system, which is MRI guided, will be used. After understanding TDCS and the procedure for it, we next need to understand major depressive disorder. Major depressive disorder can be diagnosed when a patient has at least 5 of the 9 following symptoms present nearly every day for more than 2 weeks, shown on this slide. These are just the symptoms of major depressive disorder. There are also specific neuronal mechanisms influencing major depressive disorder. These include neurotransmitters such as dopamine, norepinephrine, and serotonin, neurocircuitry of the brain, neurotrophic factors, and circadian rhythms. Developing a unified hypothesis of depression has proven difficult. This is attributed to the changing pathophysiology throughout the course of major depressive disorder. In studies involving major depressive disorder, there are 2 main cortices of the brain researchers have consistently tested on: the left dorsolateral prefrontal cortex and the right ventromedial prefrontal cortex. As seen here, the dorsolateral prefrontal cortex has several connections to other parts of the brain and several functions. However, for the purpose of TDCS, we're focusing on the function of realization and reflection of self. The ventromedial prefrontal cortex, on the other hand, is located at the frontal lobe at the bottom of the cerebral hemispheres, and its main function that we're looking to manipulate will be the regulation of emotions. Although researchers have acknowledged the changing pathophysiology of depression, the areas of interest have been determined by their function. The dorsolateral prefrontal cortex's primary function is its reflection and realization of self. Meanwhile, we are looking to manipulate the ventromedial prefrontal cortex function of exhibiting emotion. How does TDCS then work in the brain of somebody with depression? The electrodes are placed on top of the cortices in an attempt to correct an imbalance in the signaling of these areas of the brain. Researchers attempt to enhance activity of the dorsolateral prefrontal cortex while reducing the activity of the ventromedial prefrontal cortex. This stimulation causes depolarization in the left dorsolateral prefrontal cortex and hyperpolarization in the right ventromedial prefrontal cortex. This will either trigger or inhibit action potentials from occurring. The chemical imbalance is therefore said to be rectified, helping those diagnosed with major depressive disorder. Results have demonstrated some effectiveness in the use of TDCS. For those with mild to moderate major depressive disorder, TDCS appears to be effective. However, research has shown that it is most effective when used alongside an antidepressant. For those with severe major depressive disorder, results are not significantly showing any signs of benefit. One of the major limitations is the inability to truly localize major depressive disorder. The 2 aspects future research should focus on is to attempt to localize major depressive disorder and find the optimal stimulation parameters of TDCS. In conclusion, TDCS is truly only effective for someone who has mild to moderate major depressive disorder. Beyond that, there are also procedural limitations on TDCS and the understanding that TDCS is most effective when used in conjunction with an antidepressant. More research should also be conducted on both TDCS and major depressive disorder. Pause here for my reference listing.